Hi everyone, it's Dr. Novoa.
Hi everyone, it's Danielle.
So for tomorrow's show, podcast, we are talking about pregnancy, and we've had a lot of questions related to Danielle's pregnancy. So she's going to be sharing her experiences related to being pregnant, first-time mom, and also about her concerns related to, because she's small, she's little, having a baby by either a vaginal delivery or by cesarean section, because there's a lot of patients are concerned about what happens to the vagina after you have a baby. Is it the same? Does it change? What's going on down there? So, what do you think? Yep.
I'll share a funny experience with you tomorrow, too.
Okay, share a funny experience. Also, we wanted to talk about some patients have had some questions related to after having a hysterectomy, and this is for the eShore forum. After having a hysterectomy, unfortunately some women have had to go through an even worse experience with vaginal prolapse or vaginal sensitivity issues, where it's recommended that they have some type of reinforcement around the urethra, commonly known as either a Kelly plication or the placement of a vaginal sling or vaginal mesh. The problems with vaginal slings and vaginal meshes are that they're made out of similar material as the eShore device, and they have even more documented complications related to them, such as extrusion, or the fact that they migrate through the vagina makes it impossible for patients to enjoy intercourse, or they continue to have severe pelvic pain but in a different area around the urethra, especially when they're having to go to the bathroom. So we will be talking about what happens after hysterectomy and whether or not it's recommended to have some type of vaginal surgery to support the vagina, vaginal rejuvenation surgery, and also is it recommended to prophylactically have a cesarean section for women that are concerned about having a large baby and the baby or the delivery somehow changing or distorting the vaginal tissue. We'll also talk about some new devices that are out there that actually work better than the Kegel exercises or the Kegel exercises, depending on who you talk to, tomato, about reinforcing that particular tissue and how vaginal rejuvenation surgery corrects that type of problem as well. Hope to see you tomorrow, 7 p.m. Mountain Time. And you want to talk about the Mother's Day?
It'll be a Mother's Day raffle. What are we doing? A watch? Mm-hmm. It's another watch that I'm going to keep. It's a pretty watch. It's a rose gold and Klein watch. Really, really pretty. So that'll be our next giveaway. And remember one thing. If your Facebook is very private, a lot of the time, since it is a live public feed, we will not see comments, or we cannot see if you've shared it due to the fact that our Facebooks are public and we're going live publicly. It's protecting you because your settings are so private. Okay, so make sure if you do want to share the video tomorrow, when you share it, just put that post as public. That way we can see everyone who has shared the video. Or if you're wanting to comment, I know a few people wanted to comment live last time and they said that they tried and they couldn't. It's due to the fact that you have high strict privacy settings on your Facebook. Like I said, you can always just set that temporarily for the video, and when you share the video, that way we can see that you've shared and that you're able to comment on our live.
So tomorrow, again, we'll be talking about what happens with, or is it better to have a vaginal delivery or cesarean section for patients that are concerned about having large babies or somehow distorting the vaginal tissue. Also, what happens after hysterectomy or surgery where there's some problems that require surgical intervention for bladder prolapse or incontinence. Very interesting subjects. Some of the topics are controversial, but we hope to see you all tomorrow at 7 p.m. Mountain Time. Thank you very much.
Bye.